Hi students, this is going to be a very short video about the respiratory system diseases, emphysema and lung cancer. So after you learn about the mechanism, anatomy, physiology of the respiratory system, it is the time now for you to learn about the problems that could happen in the respiratory system. By learning this video, I hope you will have some awareness of how to take care of yourself to be healthy and have a happy life. The first respiratory system disease is called emphysema. You can see from the picture, from the diagram, there are normal alveoli and alveoli with emphysema. Please take a moment to observe the differences between the normal and the alveoli with emphysema. Can you see the difference? Yes, it is the total surface area. The normal alveoli will have lots of little structures that looks like grapes, which is of course the alveolus. While people with emphysema, you can see that it seems that the alveoli combine together to become something bigger. By being bigger, actually this is not a good news because without the little structures, the total surface area of the alveoli reduced. And you can see also the same phenomenon under the microscope. The normal alveoli, if you see it under the microscope, can you see the blue arrow for the normal alveoli? Yes, you can see there are lots of little structures that create surface area, large surface area. While the alveoli with emphysema, you can see that yes, it creates a big sac or bubble, but in total, the surface area is actually getting smaller. Or in another word, we can say, as you can see from the article or the uh, written information at the bottom of this slide, it is called degradation of alveolar walls that cause holes to develop and alveoli merge into huge airspace. But again, it is not a good news actually to have a bigger alveolar space because the total surface area getting smaller. So what is the cause of the emphysema? The main cause of emphysema is smoking. Of course, there is another factor which is genetics, but we are not going to discuss about genetics factor in this video. Again, the intention is to help you to understand how to maintain a lifestyle, the healthy lifestyle. This is not to scare you or whatsoever, but just to remind you that smoking is dangerous. The story of how smoking can cause emphysema starts with the fact that there is a type of white blood cell in the alveolus, or we call it alveolar macrophage. So if you can see from the diagram on your left, it looks like a sunny egg inside the alveoli. So that's the alveolar macrophage. The function of this white blood cell, of course, to protect the alveolus by secreting proteases. Proteases, or the enzyme that digests protein, is something that you have learned in chapter 2 and also from the digestive system. Why it is important to combat the bacteria? Because bacteria and foreign materials that mostly consist of protein can be digested by the protease. So that's how the white blood cell or the alveolar macrophage can help you to protect your alveolus. Next, what happens when someone becomes a heavy smoker? The chemicals in the cigarettes cause damage to the cilia and the trachea. So cilia is basically like cells that has so many hairy structure on its surface. So it looks like a brush. You can see from the small diagram on the part of the diagram on your left. So because of the cilia has been destroyed, it cannot do its job to brush out the trapped bacteria in the phlegm or the, like the liquid, the sticky liquid, the mucus inside your trachea. As a result, the phlegm, together with the foreign materials or bacteria that are trapped inside it, will go down to the lungs rather than going out to the nostril. Step 3. As the result, that dirty phlegm accumulates in the alveoli of the lungs. Of course, step number 4, macrophage start to do its job by secreting protease to kill the pathogens or the foreign materials that are trapped in the phlegm. In normal condition, lungs produce anti-protease to avoid alveolar cells from being digested by the protease. Remember, alveolus are also made of cells that consists of protein. So that's why you can see from the diagram there is what we call anti-proteases that defends against protease activity. However, step number 6, in heavy smoker case, the problem get worse, which means that there's too much phlegm that has bacteria trapped inside it, located in the alveoli. As a result, the response of the alveolar macrophage also to produce proteases in huge amount. Then it leads to number 7. However, the amount of anti-protease is not enough, okay? So as a result, slowly but sure, the alveolar cells are digested and the total surface area is reduced. As the number of the alveolus and thus the surface area in the lungs reduced, we can observe some symptoms of the patient's emphysema. Usually they have frequent coughing or wheezing, and the cough that produce a lot of mucus, of course, because the lung trying to get rid of the phlegm that is accumulated inside it, and also shortness of breath because they cannot get too much oxygen from the air because of the surface area has been reduced, and a squeaky sound when you breathe, and tightness in the chest. So those are some of the observable symptoms of emphysema patients. So that's a bad thing to happen to a heavy smoker. What are the possible treatments available for the emphysema patients? Some of the treatments include oxygen therapy. This can be done at home, in which that the patient can, get the supplemental oxygen, which is basically very high concentration oxygen compared to the environment, so that the gas exchange will happen more for oxygen because the concentration of oxygen is higher in the gas that they inhale compared to normal air. You have learned about this in the gas exchange video, right? About the diffusion and the gradient of the concentration. For a very severe case, there is another option, which is surgery or lung transplant. But of course, this treatment is pretty difficult because you have to wait, or the patient have to wait for a donor for the lung. You can see from the picture here is a fresh lung from a donor that is ready to be transplanted to a patient with emphysema. The second disease that is discussed here is lung cancer. Lung cancer, by its name, of course, is a type of cancer that begins in the lung. And lung cancer is the leading cause of cancer deaths worldwide. Why? Well, I want you to go directly to the box, the red box underneath here. It comes from, I think it's BioNinja, because of course, breathing is something important for us, very essential, very crucial for life to continue. So that's why if the lungs are invaded by cancer cells, the normal function will cannot happen anymore. And because it is very essential, the breathing, it give a very significant impact. That's why lung cancer become number one cancer that leads to death in the world. And number two, the lungs also rich in blood supply, and you know that after it leaves the lung, it goes to the heart, and the heart can pump the blood. So sometimes when the lump that contain the cancerous cells become loose, some of the cells can disattach from the lump and then go together with the blood circulation, and they can attach to another part of our body. And there are some signs and symptoms of lung cancer that include new cough that doesn't go away, shortness of breath, and coughing up blood. This is something that is usually makes people go to the doctor and they found out, oh, I have lung cancer. So something like that. Okay, so you can see the rest of the symptoms of lung cancer on this slide. And these are the risk factors that can increase the chance of getting lung cancer. I got this from BioNinja, very informative, and it is presented in a very interesting and easy to understood. So, including radiation, aging, pollution, radon gas from the environment, the diseases that could lead, for example, like chronic bronchitis and so on, that could lead to uh, cancer. And genetics, occupation. So some people who work as miners, for example, they are at high risk of getting lung cancer. Asbestos or silica, by the way, usually in the past people use asbestos for the ceiling, but nowadays it has been banned, I believe, in many countries, because science have proven that this asbestos is very dangerous. And again, smoking. So may I suggest you please not to smoke, young people, because you really need your lungs, all right, to have a healthy life. And then unfortunately, however, the second hand smokers are also at risk. So for example, like I remember one of my friends who has well, she passed away, but her husband was a heavy smoker. So her husband was actually okay, maybe because of the antibody, or I don't know, but because my friend was kind of like sensitive to the smokes, the chemicals in the smoke, so she was the one who got the lung cancer. All right. So, yeah, those are the risk factors that can lead to high risk of getting lung cancer. And how about the treatment? I think the treatment is pretty similar with any other treatments for cancer, for example, like chemotherapy or surgery. So yeah, that's it. This is a very short video. I hope you learned something about the how to maintain the health of your respiratory system by avoiding the risk factors that can cause emphysema and lung cancer.